Last week, the White House hosted its first conference on hunger in over 5 decades. The last one coming all the way back in 1969. That previous conference was 20 years before I was born, and it created programs like free and reduced school lunches and the Supplemental Nutrition Program for women, children, and infants. Some of you may know that as SNAP. But hunger in America still persists and is deeply entrenched in our society. Millions of people still face food insecurity with little to no access to nutritious food for them and their families. In the Washington, D.C. area, more than 1.2 million people struggled to put food on the table at some point last year. That's about a third of the population in and around Washington, D.C. Across the nation, 33 million, including 5 million children, are food insecure, and that's according to the U.S. Department of Agriculture. Now, the White House is touting $8 billion in public and private commitments to address the problem. So how should that money be spent? And would it help end hunger in America as we know it? Here to help me answer those questions and much more is Nancy Roman. She is the president and CEO at the Partnership for a Healthier America. Welcome to you, Nancy, and thank you. I see you got the orange memo today. In your latest piece, yes, I appreciate the coordination. You wrote a piece in Fortune, and it's titled, "It's Time for Big Food to Catch Up to 1969. And you write this, quote, "Today we spend over $180 billion providing food to families in need through these programs. Despite spending all this money that created a much-needed safety net, widespread poor nutrition and the health risks associated with it continue. What went wrong?" So, Nancy, what did go wrong?
Well, like so often, we have a generous heart as Americans, and we focused in the beginning on getting calories to people and didn't pay attention to the broader facts that it can't just be any calories. And so the consequence is we have a country where 50% of the people, as Senator Cory Booker pointed out, are suffering with diabetes or prediabetes, and millions more with heart disease. These are diet-related diseases that don't have to be. So what went wrong is we focused on food without really paying attention or just understanding as much about what our body does with food and how we use food. So I like to say nobody was intentionally being wrong, but we have a built environment full of shelf-stable, ultra-processed carbohydrates that are making us sick. And we really need to pivot.
So the White House, as we said, has secured $8 billion in commitments to address this issue. But we know that money is just one part of the problem. I think we need systemic changes as well to address food insecurity in America. I can't help but think about former First Lady, Mrs. Michelle Obama, and her Let's Move initiative and her interest in this very issue, addressing hunger in children, addressing nutritious foods, and all the backlash that she received. So what is going to be different now?
Well, first of all, it was so important what she did and what she began, and she gave birth to the organization I now have the privilege to run, Partnership for a Healthier America. And the work that was set off continued. But I don't think any of us realized quite what we were up against. I mean, human beings are animals. We like salt, fat, and sugar. And the industry has built up a food system that has a lot of long-lasting food. I mean, 60% of the food in the grocery store is going to be shelf-stable carbohydrates. And it takes a while to pivot from the system you had to the system you need. We made a lot of progress, but we have to make a lot more. And we really have to raise awareness. One of the things I've seen, and it was really on display at this White House conference, which was so important, is we think of hunger over here, and then we think of nutrition and health over here. And they're flip sides of the same coin. So often, the hunger community, and I should point out that before I joined PHA, I ran a food bank. I was with the United Nations World Food Program. Hunger is so very important, but we were addressing it with calories and not really paying attention to the kinds of food that people need. That spans the charitable system, the private sector system, and we've really got to address it now. So I applaud the administration for putting this issue on the map.
Yeah, I mean, many people asked why now, and I really think the answer is, well, if not now, when? I think about the fact that Congress failed to renew the universal free school lunches program after it expired this summer. I was a free and reduced school lunch kid, and several states like California and New York, they ended up making the program permanent, but there are millions of students across the country who no longer automatically receive these free meals. Talk to us about the consequences of this lapse and how is it going to impact child hunger and education as a whole?
Well, it's very important. And I will note that one of the outcomes of the conference was to suggest that there's universal school lunch, but also not just universal school lunch, but that it's tied in to the local agricultural system and that it's incorporating more fresh produce, because it's not just getting lunch to children who need it. But it's getting the right kind of lunch and exposing kids to fruits and vegetables and how great they can taste. I mean, I remember when I went to school, school lunch was often like a big, thick slice of pizza that was mostly bread and on cheese. And while, you know, that kind of tastes good, to be perfectly honest, but it didn't really give me the nutrients I needed as a young child.
Yeah, absolutely. I mean, the children across the country have been heavy on my heart on this particular issue. Nancy Roman, thank you so much for being here today and breaking it down for the folks. We will be staying on this story. Thank you.
Thank you.